We all acknowledge this legislation is a tremendous step forward. Why? Because it saves lives, saves money, and protects Medicare, makes Medicare stronger. We've traveled really a long ways to where we are. And tonight begins the last leg of this journey that we've been on now for some time. The American people, President Obama, have asked us for health insurance reform that does two things. One, makes it more affordable for the American people. Remember, this past year, 750,000 Americans filed bankruptcy. Over half of those bankruptcies dealt with health care costs. More than half the people who filed bankruptcy because of health care costs had insurance. So not only do we make it more affordable for every American, we also certainly do it in a fiscally responsible way. We're not going to add a dime to the deficit. In fact, quite the opposite. We'll cut the problems we have with money around here by as much as $750 billion. And this bill is going to do good things over the next 10 years for so many different people in our society. 98% of the American people, those that have Medicare will be included in that number, will have health insurance. And we'll make sure that 30 million more Americans who don't have health insurance today will soon have it. I want to repeat, we not only protect Medicare, we're making it stronger. The numbers I've just gone over are pretty impressive, and I have no doubt that the American people agree with that. Although we're proud of these figures, these numbers that we've given you, we can't afford to really overlook what this is really all about. More accurately, we can't afford to overlook who this is all about. This is about a parent. For example, my friend Jeff Hill from Searchlight, Nevada. 23 years old. He goes off his parents' health insurance policy. Within 6 weeks, he's diagnosed testicular cancer. His parents, who have no money, have already expended $15,000 having their son operated on. He's now chemotherapy, all kinds of complications. They had to put they couldn't put the chemo in his veins. We're changing this. Now it's going to be 26 years of age that people can stay on their parents' coverage. We want to make sure that every American can afford good coverage. This is about small businesses in Nevada and around the country. We have provisions in this bill dealing with small business. This is about women. We have great provisions in this bill for women. We're going to make them better on the floor. We had a real good discussion in the caucus tonight, how it's so outrageous, the word that we've gotten recently on mammograms. Women should be able to go get a mammogram and not have to wait until they're 50 years old. Pre-existing disabilities. We want to make sure that everyone who reads this bill, and it'll be online tonight, we want to make sure that everyone reads this bill, reads some of the provisions in this bill that just speak volumes. Pre-existing disabilities. I was in Texas last week, and a man came to me. He said, I'm a lawyer, I make a lot of money. He said, but I don't know what's going to happen to my daughter. She's 23 years old, has multiple sclerosis. I'm an old man now. What's going to happen when my wife and I aren't able to take care of her? Well, we know if we don't change it, she won't get any insurance. She has a pre-existing disability. So this is about families. I've talked about one family from Searchlight. This is for our economy's renewal. This is a jobs bill. And the finish line is really in sight.